Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Kristin Martin, and she is a family practice and addiction medicine physician and ER physician. She is also the CEO of River Valley Medical Wellness and president of the Arkansas Society of Addiction Medicine. Dr. Martin, thank you so much for joining us.
Thank you. I'm glad to be here.
So we're talking about naloxone today. Tell me about the recent change with it being over the counter.
Absolutely. So the FDA decided to go ahead and approve that naloxone, sometimes called Narcan, Zimhai, Cloxato, or some of the other trade names for it, approved it to be an over-the-counter medication. This really opened up some opportunities for our patients and communities to be able to have greater access to this, as it previously could only be prescribed by a physician.
And is this a nasal spray or an injection? What type of med is it?
So naloxone, as far as Narcan, right now that's FDA approved for over-the-counter, is a nasal spray. So being able to get a box of that has 2 doses of naloxone in it. And so it is a nasal spray that you would squirt up a nose, just like you would maybe Flonase or some other kind of allergy medication, right? It's as simple to use as that. But you do have to be careful whenever you use the naloxone and administer it that you don't prime it like you would maybe a nasal spray to make sure it works, because the dose is only in that one spray.
And what type of drugs is this for?
Great question. So a lot of people get confused on what naloxone is used for, but it is used as the reversal agent or the antidote to opioids. Some of those we know more commonly are hydrocodone, Percocet, Oxycontin, morphine, fentanyl. It also reverses illicit substances. Fentanyl is also known as one of those, but things like heroin, they can also reverse. But it can be used for any of the opioid drugs. It does not, however, reverse other medications like benzodiazepines, Xanax, and things like that. But it's a wonderful solution for a temporary fix for an opioid overdose.
And you are at the forefront of addiction medicine and seeing those ramifications, seeing what's happening in our state. What is happening? Are all of those drugs a problem here?
All of those drugs are a problem here. Yes, we have seen over 600 overdoses from opioids this last year in the state of Arkansas. Those numbers have continued to rise each year, which has reached an epidemic level. Certainly, if we think about over 600 overdoses a day, then we realize that's almost 2 Arkansans that die from opioid overdose each day, which is part of the reason why getting naloxone out in the communities, having people educated on how to utilize it, and us to be having these conversations is so important. It is life-threatening. Even a short-term overdose, just the loss of oxygen to the brain, can be devastating to a human being.
You mentioned education. Is there a stigma surrounding the medicine to where people are embarrassed to buy it, they're embarrassed to take it?
Yes, absolutely. It's one of the things we really are working on, that people need to understand that there are appropriate uses for opioids. We have a lot of patients that require it, maybe for short term, maybe they've had an ankle fracture or a back surgery, that they need that medication to be able to help cope with that pain that is appropriate to pain management. And then there's other times where people have chronic pain. Maybe they are a person undergoing cancer treatments and will have long-term pain and need to be able to have some kind of relief for that. And so there's those different kinds of uses for it. There's also the forms that turn into more of an opioid, not use or dependence, but turn into an opioid addiction, where we have some maladaptive behaviors or things that we need to solve, right, to be able to help them with that. And then, of course, there's the illicit use that occurs on the streets where people access it. We need to be able to have the conversations openly. Not everybody that wants naloxone is needing it because they are an illicit user. But no matter what the reason is that somebody might need it, it may be for themselves, it may be for a family member. It may be that they're in a job that they have high risk. We've heard this a lot from hospitality organizations where people that are cleaning hotel rooms, right? There may be some fentanyl that's left and somebody's wiping something down and gets exposed. Other high-risk situations, even state employees that are working in state parks and things like that may run across somebody who is in overdose and want to be able to help. It's important that we do not stigmatize against people wanting to get in the naloxone, whether it's for themselves or whether it's for somebody else, because if the drug is not out there, it cannot be used to save a life. But a lot of these conversations should be had between families, and most importantly, between your physician.
And so this goes far beyond a home. Workplace, should they have them all work environments?
Absolutely. Of course, homes are important because that's a lot of place where people may be exposed, right? There may be a child exposed, or there may be a parent or a grandparent that someone taking care of that may forget that they've taken their medication and end up with an overdose inadvertently because of mixtures of medicines or maybe a change in their health status. But also out into the workplace. We've talked a lot to hotels and hospitality, people in state parks that may run across somebody that's at one of the state facilities, that they may run onto an overdose situation and be able to save a life. We really think that this is important too as far as our schools and universities. We're seeing so many young people, of course, end up in situations, and there's a great effort going on by the state and with the drug directors and the state organizations to be able to make sure that every school, every campus has naloxone that's available, just like you would an AED or a defibrillator device in case of emergency. Being able to save a life means you have to be able to have the drug available, readily available to use. If it's not available, you can't administer it. So it's important for us to have that access.
So education is so important in the home, in workplace, schools. But tell me about resources. How do they become educated? Where do people go to learn more?
Sure. So first of all, I would always encourage people to have these conversations with their physician or healthcare providers. It's an important ability to be able to know exactly how to administer something, be able to understand the situations, be able to utilize that. And organizations like our clinic, River Valley Medical Wellness, we are a part of the Naloxone Hero Grant, where we can provide the people in Pope County, anybody that wants to come in, free naloxone doses and free education without any cost, and they do not have to be a patient of ours. We received this grant through the Arkansas Opioid Recovery Partnership, which has designated and awarded this naloxone grant to organizations in each county in the state of Arkansas. And you can go to their website and be able to look that up so that you can be able to connect with them and be able to gain those resources. There's also efforts that's been done by the Arkansas Center for Health Improvements, or ACI, and they have initiatives that have pushed out through emergency rooms so that if somebody is in crisis or needs doses, they can go to their local emergency room if that hospital is a participating hospital and be able to be provided with free naloxone there as well. We also have some different initiatives that have been done through the drug director's office and also some different pharmaceutical companies which are providing free doses to people. I would encourage you to look and see what your local resources are online, and we'll provide those websites so that people can look that up, be able to find educational material that's either seen online, but even more importantly, probably in person where you can get a demonstration, and also be able to access that if it's something that you don't either talk to your physician about, or your local pharmacist is also a great resource to be able to train you while you're there picking something up.
And one last question. Is it free or does insurance cover it? You mentioned that it is free through some programs. How does that work for the average Arkansan?
So It is free through certain programs, and there have been delegations to first responders, or as I say, through some of the hospitals and things like that. We do have it free through the Naloxone Hero Grant, and there are some, as I say, pharmaceutical companies and things that we are having different events where we give out Naloxone. But otherwise, if you are an average citizen who is wanting to have some for your home, for your car, for your work, you can actually go to your local pharmacy and ask for it. It is over the counter now. So you can get one of the cards. It is over the counter, but it's located behind the counter, and ask the pharmacist. There is a standing law in the state of Arkansas where it can be dispensed or a prescription written by a pharmacist immediately to be able to give that without having to go see your physician if you're needing some medication. It is not free in the respect that it may be charged to your insurance. And so far, the insurance companies seem to be honoring the fact that they will pay for naloxone, even if it is over the counter. I did discuss this with a pharmacist just this morning, who shared with me whenever people come to get it over the counter, that the pharmacist actually writes the script for them. So I believe that of the 7 doses that they had sold this week over the counter, all but 1 was paid for by insurance, because if the physician hadn't written one, the pharmacist instead could write that prescription and could provide that for them.
So there's a lot of options to where anyone can get it if it's needed.
Yes, there are a lot of options that anyone can get it if it's needed, and the current cost for it over the counter, if insurance didn't pay for it, is running between $45 and $50.
So if you give naloxone to someone who's not having an overdose, but you think that they are, is there side effects? Is that a problem?
It's not a problem. That's a great question. So anybody who is not having an opioid overdose, there are no harmful effects to it. And a lot of people are also confused about the fact that they're worried about whether naloxone itself could be addicting. It is not. It is simply the antidote. So there is no harm and no risk in giving the dose of naloxone if you're unsure why somebody is unconscious or you fear that they're overdosed. No difficulties with that. If there's somebody that is using opioids and you reverse them, they will have some side effects to it. They may have some nausea, they may have some agitation and things like that, but that will wear off, and more importantly, you will have saved a life. The other thing to remember when administering naloxone is it only lasts for a short period of time. So once that dose is given, call 911 immediately and wait for emergency support.
Okay. Well, Dr. Martin, thank you so much. Such important work and important information, and I hope that all Arkansans see the value of the information and keep Narcan in their homes and their workplaces and the schools. So important. Thank you.
Thank you very much for having me. I appreciate it.
Well, thanks for being here. And that's it for this episode of AFMC TV. I'm Robin Ledbetter. Thanks for watching and have a great day.